From ITC Dubai 2026, we're very delighted to be joined by Professor Mohamed Imam, Professor of Digital Health and Consultant Trauma and Upper Limb Surgeon from the United Kingdom. Professor Mohamed, we're very delighted to have you with us here today.
It's my pleasure to be here with all of you today.
How do you see the future of surgery evolving in the rise of artificial intelligence?
So artificial intelligence is actually affecting every little aspect of surgery. It affects every step of the patient's journey, from the minute they have a problem to seeing a specialist, seeing them in clinic, and to the scans, MRIs, and all these aspects. And we've published a lot of papers and we've looked into a lot of studies. Advent now of robotics and diagnostics are using artificial intelligence has significantly increased accuracy, and there are a huge potential in the application of artificial intelligence in surgery.
Do you believe that in the coming few years, robotic systems will be mandatory in trauma and orthopedic surgery?
It is still an expensive aspect. Like in my practice, we use it as a routine practice. But still, up till this moment, we have level 3 robots, which would be the robots that has to agree a plan with the surgeon, but the surgeon has to be there. And there are more and more advances happening now, and the potential is huge. And I think actually artificial intelligence is even more than robots. Artificial intelligence has huge aspects in predicting the outcomes of surgery and the outcome and the potential occurrence of complications. So I can be sitting with a patient and knowing what is the possibility based on all the data we had, whether there is a potential for a complication or not.
Interesting. And what are the long-term impacts of robotics actually when particularly combined with biotechnology in orthopedic surgery?
I think actually AI is affecting everything in our life. And AI has been there for a long time. So it is actually from the mid-50s. It's not from when ChatGPT was out. And it will continue to affect everything we do. So as I said, artificial intelligence has been here for a long time. One of the most fields in human disciplines is biotech. That will be significantly benefiting from artificial intelligence. It will save wasted times on things that can be saved. We know now that actually discovering new drugs should be easier, and it will enable us to have better understanding of what's happening around us. And the advances in genomics, biometrics, and biotechnology with deep machine learning, deep learning, and artificial intelligence in general is expected to increase the life expectancy of humans by 10 years in no time.
And what advice would you give to young surgeons entering the field of orthopedics?
So the field of orthopedics, I keep telling my trainees, you are treating patients, not scans. You are treating someone with a wife, a husband, and usually treats them as a whole. And that's what I always would say. And listening is always a very good aspect. And especially with the advances of technology, human skills like listening will be priceless.
Well, Professor Mohamed, you've seen OrthoHouse activities in the United Kingdom, in the United Arab Emirates here, and in Egypt. How do you see the role played by OrthoHouse in supporting innovation in surgery?
So actually, we're starting a couple of projects in the Smart Health Center in London with OrthoHouse. And it was impressive because we're doing a lot of commercial innovative partnership, and it was very impressive to see a Middle Eastern company thinking way ahead, and discussing different aspects, not only thinking about commercial side and making money, but are genuinely interested in making science and getting a step ahead. And I'm always impressed with that. I know at OrthoHouse for 20 years, but as in my position now, it was really impressive to see that.
If you would send a message to OrthoHouse, what would it be?
Keep doing what you're doing.
Thank you, Professor Mohamed Imam. Thank you so much, Professor.
My pleasure.
Thank you.
Thank you.